Karen Van Hoesen. I'm on faculty here. I actually did my training here at Ucsd. I was in the very first emergency medicine residency class and then finished residency, loved it so much that I joined the faculty and I've been here ever since. But then I've also had a passion my entire life for integrative medicine and more recently for medical intuition. And so it's been my pleasure to be able to work with my dear friend April over the last 10 years. And we've been kind of investigating medical intuition and how we can incorporate it into not only emergency medicine, but integrative medicine in general. She's amazingly accurate. And it's not just the, hey, here's what's going on with them, because I could eventually get to the diagnosis with x-rays or lab tests and physical exam. But behind every physical disease, she's able to look at the thoughts and emotions that is creating that physical disease that I'm seeing and trying to treat.
Usually when I first meet people, they ask me, when did you know, you were intuitive, or when did you get this? And I've pondered that question because it's like my arm, it's always been there. One of the earliest life-changing moments I had, so I was with a friend and we were walking through the store and I hit this cloud of mourning, and my heart came up into my throat and tears came to my eyes, and I stopped, and my friend was in front of the cart and he turned around and he looked at me and he went, "What's wrong?" And my voice is cracking and I say to him, I said, and I kind of tried to motion at the woman without pointing, "She's mourning." And that was a life-changing moment for me of understanding that not everyone feels things at the exact same level. Everybody's feeling them. I do not believe that I have a gift or something special. I believe every human being has intuitive senses. And just like with our smell, there are people that can smell, their smell's amazing. And then other people are like, "I don't even know what you're smelling." So in all aspects, when it comes to intuitive or senses, about 12 years ago, I wasn't really focused on developing my intuition in any specific area. And I had played around with a couple of areas that I was not comfortable with. I didn't want to find missing people or do murder cases. There were certain things that, because the sensations are so strong for me and so real, I just didn't want to do that. It was not what I wanted. And I didn't feel like it gave back to the world in the way I wanted to. So a friend gave me a book by Caroline Myss. And Caroline Myss used to be one of the strongest medical intuitives in the world. She's 96% accurate at diagnosing the human body. And it changed my life. I read that book and I resonated with it in ways I could never describe. Finally, someone was describing what I was feeling and what I was seeing, and it blew my world open. So I started to, for about 18 months on my own, playing around with it, and I finally realized I am never going to get to the level that I want to be at unless I find a doctor to work with. And at the time we lived in Hawaii, and so I moved back to San Diego with the sole purpose of meeting a doctor, and in 3 weeks I actually met Dr. Karen Van Hoesen. That was 10 years ago. We were at a gathering, mutual gathering, and I seen her in the audience, and she was the most curious person in the audience. I was watching her, and I could tell she was just so intrigued and taking everything in, and I was like, I gotta go meet this woman. And so I walked up, and we were talking, and a mutual friend of ours walked up and introduced us more formally and said, "This is Dr. Karen Van Hoesen." And I interrupt her, and I go, "Do you know who Caroline Myss is?" Because I knew if she knew who Caroline Myss was, she was going to know what I did. And she goes, "Oh my God, I love her work." And I say, "I'm a medical intuitive." And she goes, "Do you want to come to the ER?" And I was so okay, wait a minute, I didn't expect for this to happen this fast. I started to backstep, and I'm like, "Can we go get coffee first?" So we did. 2 days later, we went to get coffee, and then within 8 or 9 days, I was in the ER for the very first time. And one thing I really want to note here is I was petrified. I mean, I was so scared, and it's really hard to read and feel your intuition when you're petrified. I mean, I was so scared of doing something wrong. I wanted to develop this. I can't even tell you how much my heart wanted to do this, and I didn't know Karen at that time. I didn't know how patient she would be. I didn't know what she expected. I was so scared of failing. And you'll all go through that when you go to develop your intuition. I was petrified. This was not just an easy laid out road for me, even though meeting her was fast. It was work.
So like in the emergency room, you have a computer system. It has their name. There's always a chief complaint. Chest pain, shortness of breath, abdominal pain, shoulder pain. It's taking that pause and saying, okay, this is John, he's 27, coming in with ankle pain. And then just saying, okay, show me John, and whether I close my eyes or leave my eyes open, there's that kind of picture screen where you imagine things. I mean, some people call it imagination. That's what you used to call it, your imagination. Is it your imagination, or is it, it's really your intuitive ability and you're seeing things? It's just saying, show me his ankle. And so in my mind's eye, seeing, and, is there a fracture there? And seeing whether there is or not. And then trying to see if that's right when the x-rays come back and after the physical exam. So it's tuning in with that person before you even go see him, and just see let's call them impressions. I'd like to share some of my experience in working with April over the past 10 years. And some examples, and then kind of like where we're going and what we'd like to do. One of my favorite examples, and this just happened fairly recently at Thornton, there was a 9-year-old boy that came in. He was from out of town a year before he had gone over the handlebars on his bicycle, and he'd had a head injury. His scans had been negative, but he was left with these, what they were calling migraine headaches. And he would get super hot, anxious, get a really bad headache, nausea, throw up. It would last a few hours and it would go away. So his MRI scans were normal. He was being referred to a neurologist for migraine headaches. And so I'm talking to him, it's like, well, this isn't really like a pattern of migraines. And at that point, I felt really ineffective because all I could do was offer this kid pain medicine. And I could make him feel better, but I didn't know what to do to treat his headaches. I didn't have any recommendations. Just felt kind of ineffective as a healer. What could I do? And he was going to go down the route of the neurologist and stuff. And at this point, April's been coming in and hearing me take the histories and even asking some questions. So I'm done with all my questions and my exam and kind of talking to patients. And then April says, well, I have a question for you. And she's looking right at the 9-year-old, and she says, you're reliving this trauma in your head, aren't you? And you're having nightmares about this. And the sweet little 9-year-old looks up at her and says, yeah. The look on the parents' faces, their jaws drop. They had no idea their son had been having nightmares about this trauma. And April was able to see that on a much more kind of emotional level of what was going on in the child. And all of a sudden it was like, you're not having migraine headaches, you're having PTSD. And he doesn't need a neurologist. He probably needs more of a therapist to help him go back in time, go back through, re-experience kind of the trauma and process those emotions and get rid of it. And that's probably what would make his headaches go away, not migraine headaches. And so that's where seeing how that emotional and spiritual part kind of ties in to the physical presentation of their symptoms is where there's been the most benefit for me in emergency medicine.
And about 4.5 years ago, I became very passionate in military PTSD, and I was working with a lot of people, and I realized I had a knack for it because I could see their story, I could see where they were trapped in time. And so it's fascinating to me because I'm like, okay, how do I get you out of time? You're in this loop, it's creating migraines, insomnia, it's sensations in your body. And it was a huge fascination for me because I could not figure out, I could see the sensation, it looks like grain of wood to me, all woven throughout like the muscles and the different cell tissue. But I could not figure out how to get the emotional body out of the cell tissue. And so, we're medicating them, we're helping them numb. There is a lot of talk therapy to help them get out of time. But the sensations is one of the biggest struggles with PTSD. They keep having the sensations. And I stumbled upon a practice which is breath work. Paul Mills has done some research in breath work, and I want to do more. Because it is the one technique I found that moves the emotional body out of the cell tissue. And it doesn't just move it and it comes back. It will move years of history by using breath. And I've done it on Karen for her acid reflux and GERD, and it will go away. So it will do, I mean, she'll be in so much pain and taking medication regularly. I'm like, okay, let's do a breath session. And she can completely even stop taking her medication until she goes back and builds up the thoughts and the emotions again, and then she gets in pain again, and we have to do it again. So there's a lot for us to discover. So the coolest case, by far, this one blew me away. There was somebody up there in triage that I had to go see. I was so drawn to him, and I'm like, Karen, we have to go see that man. And she's like, okay, let's go. So off to the front we go. And we get up there, and of course the nurses are like, you know, what do you need? Because she never goes up there. You know, what do you need? And she's like, oh, I just want to talk to this patient. And so as she's talking to him, and I can see his name and his age, and I'm starting to read him, and what I'm seeing in my mind is a X-Acto blade, and it looks like it's slicing through his heart, making this perfect line. And I see like this bulge, and it's forcing this separation. And I'm getting this sense like, this man is going to die. In 10 years, I have never said to Karen, this person's going to die.
When she told me she saw this X-Acto knife cutting through the kind of the heart and the aorta, and it was bulging and could potentially rupture, she was describing an aortic dissection, which is where the walls of the aorta kind of split apart, and you get two channels of blood flow, and it weakens the walls, and they can rupture. And people, if that happens, they can instantly die from that. They'll just bleed out into their chest. We called CT surgery, got him transferred up to the cardiovascular service at Thornton, and he ended up doing okay. But that was just one of those times where her impression was so exact that it actually made me speed things up. And I can diagnose a heart attack based on the EKG and the troponin. April's able to see the heart, where the blockage is, but then also the thoughts and emotions behind what actually causes heart attacks, which most of the time is when people don't let love flow through their heart, and they're blocking that love from flowing through, and eventually oftentimes it presents with an acute heart attack.
So I look at things as it being like a DNA. You have an emotional DNA. When we're talking about, you know, love flows through the heart and that creates heart attacks, you've learned that somewhere. That is not something that you just picked up. So even behavior, even your emotional body is something that you have learned, and it starts as early as even in the womb. That we start to as how the mother processes emotions, how the father processes emotions, and so that starts to create that emotional DNA. The thought patterns, which is the story, also creates a DNA, and then that all goes into creating the physical DNA. And so that is how we see it going from family to family. It's not only just physical DNA that's being transferred. You also are learning how to process emotions. You're picking on some of the same thought patterns and stories that you learned from your parents. And it will basically go from like generation to generation. So we can understand how one is not separate from the other. It's impossible for it to be separate. They're all hand in hand. They're all functioning and moving as one.
The next step is then, can you teach this to anybody? Because as April says, we're all intuitive. You all get those pictures in your head. You know, some people see things, some people feel things, smell things. I'm working with the thought processes of why that's going on, and basically taking that pause before I go see the patient and asking myself, okay, show me John Smith. What's going on with him? And seeing that picture in my head, and what am I feeling? Where's the highest energy loss?
When you believe that thought, well, is it true? Obviously, it's true to you. How does it make you feel when you feel it? How would you feel if you didn't, think that thought at all? So there's definitely different ways to work with thought patterns to help them dissolve and question what you believe is truth, to break it down. So a lot of my developing it was figuring out, what am I seeing? Because I didn't walk in going, oh, this means this. So it's taken a long time to go, oh, well, every time I feel like a bug zapper in my nervous system and my immune system, feels like it's having this war go on, it's AIDS. And it took me being in the environment and seeing it over and over and over again to figure those things out. I think a turning point for me was really early on. I was an older man, and when I first stepped into his energy, the sensations, that empathic feeling was I couldn't breathe, and my chest was hurting, and my left arm was kind of aching, and I'm describing this to her just like I'm doing to you guys. And I look at her face, and she looks kind of puzzled, and she's like, okay, well, if you push that out of the way and you go lower, what do you feel? And I could see this hole in my foot. and it's all black, and then my foot started to hurt. I had a dress on, and so I pick up a pen off the cabinet, and I'm drawing lines up my leg. I'm sitting in front of a world-renowned doctor that's only known me 2 weeks, and I'm drawing lines on my leg. And she sits down and she says, okay, so this man was here about 2 weeks ago. He stepped on a nail, and he has, we gave him a tetanus shot and antibiotic. He went home, he decided to stop taking his antibiotic, and he has, gangrene or something, and he basically came back, and the lines you're drawing on your leg are exactly the lines, like running up his leg. She said, but when you said what you did, it made me concerned. So she went back and she asked him, about his heart.
After getting the EKG and everything else, he was having demand ischemia from the sepsis that was actually causing some ischemia to his heart and giving him the symptoms of chest pain and shortness of breath. Maybe I would have eventually got there, but that wasn't apparent at the beginning until she kind of pointed out the highest energy loss to me.
Well, one thing she did to me in the early stages, I'll never forget, but she challenged me and pushed me, is I took forever to read back then, and she was standing at the door, and she says, okay, the patient would be dead already. And she walked away because, well, she had nurses and patients and people to see, and I'm taking forever. But she pushed me, and it made me create tools, and how do I do this faster, and how, I'm reading way too much history here, and so every step was amazing, and she's always been so open, and it gave me a beautiful platform to really figure out how to do this, and I am very, very grateful. Thank you, all of you, for coming.
Thank you so
Thank you
much.
very much.